Thank you, Mr. Chairman. Thank you for taking time to visit by phone, and we all value your willingness to serve our country. You started the testimony referring to the painful impact of coronavirus on all of us. Rural communities, as we talked, are facing significant challenges, especially as a result of the pandemic. We talked about rural health needs and getting physicians and training into rural communities. You know, I'm a doctor who practiced in Wyoming for over 2 decades. I'm very interested and focused on protecting and improving health care in rural America. The one aspect of health care that's often overlooked are the many factors outside of direct patient care that impact the health of individuals. According to the Centers for Disease Control and Prevention, social determinants of health have a major impact on people's health, well-being, and quality of life. And when you were in the House of Representatives, you actually helped draft legislation requiring the Secretary of Health and Human Services, which you're now nominated to serve, to conduct research on social determinants of health in Medicare's value-based programs. So then you agree that social determinants of health, such as employment, educational opportunity, all strongly impact the health of individuals. Chronic unemployment is harmful at a high rate. And that's why I'm so bothered that one of the first actions taken by the Biden administration was a ban on oil and gas leasing. And the impact of that on jobs in my state are just devastating. It's killing jobs, it's killing hope in communities. People are worried about raising unemployment rates and all of the issues that come along with that. These industries create thousands of jobs, contribute hundreds of millions of dollars to states, and the states that the money is used, education for schools, for students, and helping hospitals stay open and stay viable in these communities. And the Biden administration's decision is clearly going to have a terrible impact, I believe, on health and well-being of communities in Wyoming and across rural America. But it's a decision made by Executive Order Day 1. Do you agree that cutting hundreds of millions of dollars from hospitals and schools is going to have an impact on health in rural communities?
Oh, Senator, well, first, thank you for the question, and thank you for the chance to chat by phone. Anytime a community is impacted where it loses jobs, it loses access to care and good schools, you're going to see impacts. And so I think we all want to make sure that we're doing everything possible to make sure that every family, wherever they locate, has the opportunities that we expect in America.